Hello, everyone, and welcome to today's webinar presentation. My name is Holly Kilmes-Packett, and I'm the Public Policy Director for the American Academy of HIV Medicine. Today, we're going to look at AAHIVM's new health reform resources for HIV providers. Thank you for joining us today, and we hope that you find the webinar presentation helpful. It's been 3 years since the health reform law was passed, almost 4 now. The law was passed in 2010, and upon its passage, some immediate changes went into effect. Certain patient protections with regards to insurance were put into place, such as an end to lifetime limits and a prohibition against insurers being able to drop patients from their coverage based on pre-existing conditions. Also, a new ability for adult children to remain on their parents' insurance up to age 26 was put into place. But most of the law was scheduled for a date and time in the future, namely 2014. And since then, it has appeared, at least on the surface, as if not much has happened in the last 4 years. But behind the scenes, quite a bit has been taking place. The PSIPs, or pre-existing insurance plans, were created in every state, and those are effectively high-risk insurance pools for individuals who couldn't obtain insurance coverage to have a coverage that bridged the years from 2010 to 2014. The Medicaid expansion option was offered to states, and the states were given instructions to either establish a state-run insurance exchange or marketplace, or to allow the federal government to come in and organize one in the state instead. And at the federal government level, HHS has been issuing a slew of regulations defining and clarifying various aspects of the law. And now the full implementation of the law is just around the corner. The full law goes into effect on January 1st of 2014. The individual mandate takes effect at that time. And also Medicaid expansion in the states that have accepted it will go into effect on January 1st, 2014. But even sooner than that, the federally facilitated exchanges and most state-run exchanges are opening for open enrollment on October 1st, 2013, so just 30 short days from now. Many of the state-run exchanges will open at that time. However, a few states are lagging behind with regards to being ready for open enrollment. But we will see open enrollment in every state this fall. So many of your patients are going to be experiencing changes in their coverage starting next month and continuing throughout the next year. And that leaves most providers asking the question, what is happening in my state? Because the implementation of the ACA law is happening differently in every state because it affects the state Medicaid programs, the state-run white programs, and because the states had options with regards to setting up their exchange, it is going to look a little bit different in every state. So it is important to find out exactly what's going on in your own state. But more importantly, most HIV providers right now are asking, am I ready for these changes? So today's webinar presentation is going to go over some of the most important things that you need to know with regards to getting ready, such as, do you fully understand the Affordable Care Act law and some of the most important terms and concepts associated with it? There are 3 acronyms on the screen right now: Qualified Health Plans, Essential Community Providers, and Essential Health Benefits, or QHPs, ECPs, and EHBs. We're going to go over each of those today and make sure that everyone is familiar with them. And we're going to take a look at which of your patients will have coverage changes coming soon, and is your practice ready for the implementation of the health reform law? So today's agenda is going to be a review of the health reform law, and we're going to take a general look at it and make sure that everyone is on the same page and familiar with the most important concepts of the ACA. And then we're going to take a look at the AAHIVM Health Reform Resource Center for HIV providers. The health reform law is officially known as the Patient Protection and Affordable Care Act of 2010. It's sometimes referred to as the Affordable Care Act, or the ACA for short. and it is the farthest reaching health law since the 1960s, since the implementation of Medicare and Medicaid in the country. And we're going to take a moment now and look at the 4 most important aspects of the law to HIV providers and their patients. And those are the individual mandate, the Medicaid expansion, the state insurance exchanges, and the Ryan White program. So the individual mandate is a requirement for all citizens to obtain health coverage and retain it throughout the entire year or face tax penalties. This mandate does apply to U.S. citizens, and that includes children in the country as well. However, for most U.S. citizens, about 80%, this is not going to change their health care coverage. If a person already has health coverage, the mandate is fulfilled by that coverage. So if they already have health insurance from their employer, or if they're already covered under the Medicare, Medicaid, or CHIP programs, or if they receive benefits from TRICARE or the Veterans Health Program, they have already fulfilled the requirements of the individual mandate, and they don't need to change their coverage, as long as that coverage extends throughout the entire calendar year. Now, you'll notice that I don't have the Ryan White program included in this list, and there is a reason for that that we will get to a little bit later in the presentation. But any lapses in coverage could see an individual facing tax penalties, and those will be enforced by the IRS when an individual files their federal taxes at the end of the year. One of the biggest changes in the HIV world is the Medicaid expansion option to states. The Medicaid expansion provision of the health reform law was originally a requirement to all states to expand the Medicaid program coverage in their state to 133% of federal poverty level without categories. So this expansion would have covered childless adults, and it would have covered individuals without the requirement of a disability designation. There was also a 5% income disparity provision built into the law, so it could cover as high as 138% of federal poverty level. However, as most of you are familiar with, 22 states actually sued the federal government over this provision in the law, and that case went to the Supreme Court, and the Supreme Court ruled that the federal government could not require states to expand their Medicaid program. So this provision of the law became optional to states, and it's now commonly referred to as the Medicaid expansion option. Many states have gone ahead and decided to take up the Medicaid expansion. Some have refused, but we do believe that this will eventually be a fact in all states and be a provision that all states take the federal government up on. There's a reason that we think that that will occur. First of all, there's a lot of funding built in for this expansion into the health reform law. The federal government under the law will pay for 100% of the expansion for the first 2, and actually it's 3 years of the expansion. And then after that point, funding to the states slowly decreases down to 90%. However, it will never drop below 90%. So between 90 and 100% of this expansion is covered for all states. And it is 100% for the first few years. So this is an opportunity to states to cover a much larger pool of their state citizens with health coverage for free, essentially. And it is a provision that's being paid for by the federal government, so essentially it does come out of federal tax money. So those are a couple of reasons that we believe that eventually all states will go ahead and take up the Medicaid expansion. We also have seen historically that programs like this, even when states initially reject them or are wary of them, they eventually do come around and take them up. A good example of that is the Children's Health Insurance Program, or CHIP program. Initially, some states did not buy into that program, but now it is a program that is offered in all 50 states. So we do have some precedent for believing that eventually the Medicaid expansion will be taken up by all states as well. The next big change that is coming to states from the healthcare reform law is the implementation of state insurance exchanges in every state. These exchanges truly are marketplaces for individuals to shop for private insurance plans on an individual basis. Insurers, and these are, again, private insurers, will be offering new qualified health plans in the marketplaces or exchanges. So that is the first acronym that we put up on the screen a little while ago, QHPs, or Qualified Health Plans. In order to be designated a qualified health plan in the exchanges, there are certain things that these health plans have to cover and have to maintain, such as all of the qualified health plans will cover certain essential health benefits, and that is the second acronym that we showed on the screen earlier in the presentation. These essential health benefits are 10 categories of benefits that were required under the law for the qualified health plans to cover, and they're benefits such as mental health services. So one of the great things about all of these qualified health plans is that we know that they will all cover a minimum level of services for their beneficiaries. The qualified health plans will also be tiered in both prices and benefits. And the tier names are the names of metals. So the lowest level of both cost and benefit level is the bronze plans. And then going up from there, you have silver plans, gold plans, and platinum plans. The health reform law also made tax credits available for individuals who are purchasing plans in the exchanges up to 400% of federal poverty level, and those tax credits are also tiered. The tax credits can be taken upfront and immediately applied to the cost of the purchase of the new plans, or they can be taken as a tax refund at the end of the year. But in all likelihood, most individuals will probably choose to take the tax benefit up front and apply it to the costs of the purchase of the new plan. Another requirement for the qualified health plans under the law is that they are required to contract with certain essential community providers in their network. And this is great news for HIV patients and providers. Because essential community providers, as defined by HHS, are providers that traditionally provide services to medically underserved populations. And HIV has been designated as a medically underserved population by HHS. So in theory, all HIV providers should also be designated as essential community providers. But HHS and CMS also work together to define certain categories of providers that are automatically designated as ECPs. And one of the categories of providers that are automatically ECPs are Ryan White providers, which is another piece of great news for HIV providers. Ryan White providers are not the only ECPs. Others include federally qualified health centers, but you can see the entire list of ECPs on the AAHIVM website. Now, the plans are required to contract with ECPs, and the insurers offering these plans have the burden of demonstrating network sufficiency in terms of the network of the plans. And so they are not required to contract with all essential community providers in an area, but they do have to contract with a minimum number of ECPs in the area, including one type of provider from each of those ECP categories within a geographical region. And the burden of demonstrating a sufficient network is on the insurers. So again, this is great news for HIV providers because many providers, HIV providers in this country will have access to contracting with these private insurance plans in a way that you never have before. So what all of this means is that many of your patients are going to have access to new forms of insurance coverage as soon as next month and beginning next year. In some states, they will have new access to the Medicaid program. Starting in 2015, many of them will have new employer insurance options. And starting next month, there will be new affordable private insurance options to individuals. So we're about to enter an enrollment rush period. And those of you who were here during the Medicare Part D enrollment period will remember what this looks like. During Medicare Part D, we saw national campaigns on TV and radio and on the internet advising seniors that they needed to get enrolled in the Medicare Part D plans. And there was significant community outreach throughout communities all over the United States to that effect. And we're about to see a very similar period take place with regards to enrollment in the new exchanges and new Medicaid expansion options for HIV patients. However, we would like to caution that HIV patients really should take their time during this enrollment period, because although they do have that requirement to have health coverage by January 1st of 2014, they can obtain that coverage up to December 15th of this year and still have it take effect on January 1st. So they have a few months to really take their time and consider their options. And for those of you who treat HIV patients, it should be obvious that their care and their needs for drug coverage and treatment coverage is unique and specialized, and they really should consider all of the options available to them and make sure to choose the plan that is the right one for them. But in terms of this enrollment rush season that we're about to enter, the federal government and the state governments have taken a one-stop shopping, no wrong door approach to enrollment. So patients will be able to utilize a single enrollment form to determine if they're eligible for Medicaid expansion in their state or even traditional Medicaid in the states that aren't expanding the program, and if they are eligible for purchasing insurance in the new exchanges or marketplaces, and if they're eligible for those tax credits to do so. And they'll be able to determine all of that through the use of one enrollment form. So that is great news. It's a greatly streamlined process from what we've seen in the past. Patients will also be able to enroll in these programs over the phone, over email, on the internet, and in person. And the law made enrollment counselors available in every state to help get patients enrolled. So there's a lot of good news with regards to this enrollment rush period that we're about to enter as well. Now, what about the Ryan White program? What does all this mean for Ryan White? Well, you will remember that earlier in the presentation, the Ryan White program was not listed on those forms of insurance coverage that went ahead and satisfied the individual mandate. And the reason for that is that the Ryan White CARE Act, which is the law that created the program, has a very strict clause in it that is the payer of last resort requirement. And most of you are familiar with the fact that that means that Ryan White has to be the program that is the payer of last resort, or is a program that only offers services when individuals have no other availability of receiving them. So if individuals have access to any other form of coverage, including the Medicaid program in their state or the ability to receive tax credits to purchase new qualified health plans in the insurance exchanges, they must go ahead and take that form of coverage first. And if individuals have access to spousal benefits or perhaps employment benefits that they haven't accessed previously, they must go ahead and utilize those first as their primary form of coverage, because the Ryan White program cannot offer that when individuals already have other available forms of coverage to them. For providers, what this payer of last resort requirement means is that reimbursement payments through any of these other services should be considered payment in full for any services offered during a visit. So if a patient is covered by the state Medicaid program, then the Medicaid program must be billed for their services instead of Ryan White. And Ryan White has always been a program also of wraparound services, and that will continue to take place because even with the payer of last resort requirement, if certain services are not covered by an individual's primary form of coverage, they can be offered through the Ryan White program. So one good example of this would be medical case management. And many of you are familiar with the fact that traditionally state Medicaid programs have not been terribly generous with offering adequate medical case management for the needs of HIV patients. And so that is a service that the state Ryan White program could continue to offer as a wraparound service to a state Medicaid program. And also in states that are not expanding the Medicaid program, there will still be individuals not covered by the insurance exchange. And Ryan White can continue to offer services to wrap around for those patients, offer safety net services for those patients as well. However, the Ryan White program and the agency that administers it, the HRSA, the Health Reform Services Administration, has stated that there will be an expectation of enrollment efforts demonstrated by grantees. So what they want to see is that grantees are making a good faith effort to get patients who are eligible for these other forms of coverage enrolled in those forms of coverage and not just skirting around the new systems. So that is something to keep in mind with regards to the Ryan White program in every state, is that for your Ryan White patients, many of them are about to have new access to other forms of coverage, and they will need to go ahead and utilize that coverage first, and then only utilize the Ryan White program to help wrap around those services. However, there is also the ability in some states, and this is going to be something on a state-to-state basis, for Ryan White to help with some of the cost-sharing requirements or with the purchase of insurance for individuals who still can't afford it. But this will be something that happens on a state-by-state basis, and you need to check in with your state Ryan White office to find out the exact details of how some of these provisions are being implemented in your state. HRSA has also recently posted much more detailed guidance on all of these subjects on the HRSA website. So if you haven't been to the HRSA website recently, I really urge you to go to HRSA.gov and look under the HIV/AIDS Bureau page, and they have posted detailed payer of last resort guidance for each part of the Ryan White program about how some of these services, both wraparound and safety net services, will interact with the new systems of care under the ACA. So I urge you to go and take a look at those. So all of this naturally leads up to the question for providers of what you should be doing right now in the coming months with regards to getting ready for all of these changes. We have 4 months until the law fully takes effect in the country, and over the next 4 months, we urge you to do a couple of things, such as check in with the state Medicaid program and make sure that you are fully connected to Medicaid in your state. And this also includes states where you are not expanding Medicaid yet. If your state has not taken up the Medicaid expansion yet, you will still see more patients taking advantage of the Medicaid program in the state as they go to enroll in health coverage. They may find out that they were eligible for it and didn't realize it. But as a provider, it's very important that you become connected to the state Medicaid program in your state, and that is both the traditional fee-for-service program and any managed care programs offered under the state Medicaid system. And there's a couple of reasons for that. One is that you will see an influx of new patients into the state Medicaid program, both in the states that are expanding Medicaid and also to some extent in the states that are not. And also, again, we expect the states that are not expanding Medicaid yet will eventually do so. So it's going to be very important in all states for HIV providers to be fully connected to the state Medicaid system. But more importantly than that, we saw a very recent example in the state of California. California went ahead and expanded their state Medicaid program early through a waiver with the federal government. They expanded their program almost 2 years ago now. And when they went ahead and expanded the state Medicaid program, many HIV patients in the state became new Medi-Cal patients under the state Medicaid program in California. And unfortunately, in that process, a lot of patients were referred to providers under the state Medicaid system that were not the appropriate type of provider for them or not the appropriate situation for them. And some of that had to do with the fact that providers had old information registered with the state Medicaid office and or were not fully connected to the state Medicaid system. And so it left some HIV patients without access to their HIV provider who they have a relationship with. And that's something that we want to make sure to avoid in other states. So if you are an HIV provider in any state right now, we recommend that you sort of renew your relationship with the state Medicaid office. Go ahead and contact the state or local office and make sure that they have up-to-date information for you, both contact information and information on the type of provider that you are and your patient population and the type of provider setting that you're in, and also make sure that all of your billing and coding requirements are up to date with the state Medicaid program. One example that we saw come out of California was an HIV patient who was an HIV positive man who got referred to an OBGYN in the state of California. And that is because the California Medicaid system had that OBGYN provider listed as a primary care provider. And even though that was technically correct, it was not the right type of patient setting for that patient. So it's a really good time to go ahead and sort of check up on and renew your relationship with your local Medicaid office and make sure that they have all of your information correct and that you're fully connected to them, and also to any managed care programs in the state. With regards to the state insurance exchange or marketplace, one of the most important things that HIV providers can be doing right now is to contact the insurers who are offering plans in the state exchange and get contracted with their provider network. This is not a completely unfamiliar and new system for HIV providers. These are just private insurance companies, and they're offering private insurance plans. So you're looking at contracting with a third-party private insurance provider, which many of you have had experience with before. But contracting with these new insurers and these new plans in the state exchange will be beneficial to HIV providers, because the more networks you're in, the more patients throughout the state you're going to have access to. And the broader your system of networks that you're connected to is, the more likely that your patients will be able to continue seeing you as their provider. So getting contracted and getting included in these insurers, networks, in the exchanges is sort of the name of the game right now for HIV providers. And don't forget that you all do have a benefit with regards to contracting with these networks, and that is that the insurers in the exchanges are required to demonstrate that they have sufficient network capability for patients, and they're required to contract with essential community providers. And again, that should include most HIV providers in the country, and it does include all Ryan White providers. Now, again, they're not required to contract with all essential community providers in the area, but they do have to demonstrate a minimum level of network sufficiency in a geographical region. So this is a benefit that you have, or a leg up going into trying to set up these contracts with these private insurers. Another point that you should be familiar with regards to the state insurance exchanges and the insurers and plans operating in them is the new agency at HHS called, for short, CISIO, or the Center for Consumer Information and Insurance Oversight. And that is an agency at HHS, and CISIO is the agency that is overseeing the exchanges and the insurers and plans operating in them. And so if you're experiencing any difficulties or plans with regard to getting contracted with the insurers in your network, CISIO would be the place where you would report any problems to. CISIO also published on their website a list of essential community providers for insurers to begin contacting with regards to filling out their networks. They refer to this as a non-exhaustive list of essential community providers. And unfortunately, it was fairly non-exhaustive in nature. They used rather old information in terms of populating the list. So some HIV providers were not at all listed on this list, and some of them were listed with old or inaccurate information. So if you haven't already checked that non-exhaustive list on the SOCIO website, we urge you to go and take a look at it and make sure that you're listed on it, or if you're not, contact SOCIO and ask to be listed on it, because insurers are using that list as their sort of starting place for filling out their network in a state. And the other thing that you should be doing over the coming 4 months as an HIV provider is talking with your patients. And there's a temptation to think that this role is going to be filled by case managers and other enrollment counselors, but it is something that you as a provider really need to do, is communicate with your own patient pool and not leave it up to everyone else. And some of the most important things that you can communicate with them are which plans and insurers you are in network for. Because again, most of your patients will want to stay with you as their provider if they have an option, and they don't want to select a plan that puts you out of network for them. So communicating with them about what plans you're in network for is a very important thing that you can be doing over the coming months. You can also talk to them about the Ryan White transition. Your Ryan White patients should be aware that they need to take advantage of these other forms of insurance coverage that are available to them if they do qualify for them. And you can also communicate with them and reassure them that during this enrollment rush period that they can and need to slow down and make sure that they're choosing the best option for them, and that they can have until December 15th to obtain coverage, and it will still take effect on January 1st, and that they really need to be considering what the best option is for them. Another conversation that you can have with your patients, and should, is about selecting the best option for them with regards to the network that they're in, the formularies that cover their drugs, and maybe referring them to a proper case manager in your facility or in the area who can help guide them through some of these very detailed decisions. There are also enrollment counselors available in every state, and you can actually look up the list of patient navigator organizations in your state on the HHS website. So you will, as a provider, want to become familiar with the enrollment counselor centers in your state and in your area so that you can refer your patients to those enrollment centers to help get enrolled in the new system. So that's a lot of change that's coming up very quickly for HIV providers. But we want you to know that AAHIVM has some tools to help you navigate through all of these changes and all of these recommendations. Specifically, last week, AAHIVM launched the Health Reform Resource Center for HIV providers on our website. And if you go to www.aahivm.org, you'll see on our front page in the bottom right-hand corner of your screen, make sure the capital and the title, Health Reform Resource Center for HIV providers. If you click on that, you'll be taken into our Resource Center, which has 3 different parts. There is a section that focuses on health reform policy, a section that is called Health Reform in My State, and a Provider Resources section. The Health Reform Policy section of the resource focuses on the health reform law and tries to really break down the information in the law in a way that is brief and digestible for busy HIV providers to get through and understand what they need to understand. We tried to stay away from weighing down a subject with every exhaustive detail of the policy under the law, and really just focus in on the most important pieces of the information that HIV providers need to be aware of and know right now. So again, if you go to that front page of our website, you can access it, or you can access this same section under our Advocacy and Policy tab under the Health Reform section. And what we have in there is for example, some background on how the law was created, but a lot more detailed information about the individual mandate, the tax penalties associated with it, the tax credits that are available to individuals who are purchasing new insurance plans, information about those essential health benefits, those 10 categories of benefits that all of the plans are required to cover, and a lot of information about the state insurance exchanges and all the details of the qualified health plans within them, including information on premiums and pricing, and we have some of the dollar amounts that we are aware of so far listed. And there's also a page about that all-important essential community providers provision under this section. So again, we have very valuable information on there, but it's presented in a brief and digestible format for HIV providers. The next section of the health reform resource for HIV providers is Health Reform in My State. And this is a section that goes over the implementation of the health reform law in each state. And when you go to it, you'll be able to select your state off of the map, and there will be specific information for your state about the Medicaid expansion in your state or the Medicaid program in states that are not expanding, and also the state insurance exchange or marketplace for each state, and some background about how all of those systems were set up and the decisions that were made by the state leadership in terms of establishing them. So when you select your state, under the Medicaid section, there's information about the state Medicaid system as it exists in the state, including any managed care plans offered under the state Medicaid program. And under the managed care plans section, we have listed not only an entire list of all of the managed care plans offered in each state, but also the websites and contact information for providers looking to contract with the managed care plans. So this is a great one-stop resource for HIV providers to go to look to connect to each of these managed care plans in the state Medicaid system. And again, connecting to those plans ensures that you'll have access to the patients who are in them. So it's something that you want to be doing over the coming 4 months. There's also a lot of information about the background of the state's decision on Medicaid expansion and how that happened. Under the state insurance exchange page for each state, you'll find information about what type of marketplace has been established in the state, whether it's being run by the federal government or the state government, and how providers can get connected to it specifically. There's also, similarly, pages of information about the exact plans and insurers that are going to be offered in the state exchange for each state. We have a list of all the insurers offering qualified health plans in the state and their the companies that are operating them, the websites for those insurers and those plans, and most importantly, the contact information for providers who want to contract with them. So again, this is a one-stop shop for HIV providers in terms of starting to get contracted with those new plans in the state exchanges. And we hope that you guys will go and take a look at it and use it to get started over the coming months. Now, there is one small catch to this section of the website, and that is that for the federally run exchanges, we won't have information on which plans are being offered in the state exchange and which insurers are operating in each state until October 1st. But after the beginning of October, we will be able to fill in that information for states with a federally run exchange as well. And over the months of October, November, December, and January, you as HIV providers will be able to go to this section of the website and see the insurers that are operating in the state exchange and begin contacting them with looks to contracting to be included in their networks. The final section of the AAHIVM resource for HIV providers is the Provider Resources section. This Provider Resources section can also be accessed under a tab on our homepage. And when you go under the Provider Resources tab, you'll go to Practice Resources. And under there, you'll find a a section called Health Reform in My Practice. This is a resource center for HIV providers specifically. So it's not for patients. This is the section that talks about your practice and how to get your practice connected to the new systems of health reform, to the state Medicaid system, to managed care system programs in the state, to the new state exchanges. And there's also information on there about your patients and how health reform will affect your patients and how you can talk to your patients. There's a separate section under the same tab called Patient Assistance, and that's a section for patients. So if you want to refer your patients specifically to that section of the website, there's information for them about all of these same topics. But under the Health Reform in My Practice section, we have guides available for you to download on a number of different subjects and a lot of other resources as well about getting your practice connected to the plans and the exchanges and contacting insurers and identifying yourself as an essential community provider and how to go about contracting with that third-party private insurance and the plans that are offered in the new state exchanges. So we hope that you all will go and take a look at those. You can download them, print them off, and use them to get your practice connected to the new ACA systems. Under the For My Patient section, we have information for you about patient enrollment counselors in the state, and these again are enrollment counselors that you can refer your patients to help get enrolled. And there's information about the single form application and the patient navigators and certified enrollment counselors in your area. There's also information on how to go about looking at having a member of your own practice designated as a certified enrollment counselor, and there is training available to them from HHS. So you could have a certified enrollment counselor in your practice for your patients to help get them enrolled and help guide them through choosing the right plan for them. There's also information on helping patients choose the right plan for them, and we know that most patients are likely to ask their providers about what the best plan is for them, and there isn't any need to rush through that decision. But we do have guides available for how you can begin that conversation with your patients, and the guide that we have developed is something that you can either print off and keep on your clipboard and use to guide the conversation with your patients if you have 2 minutes in their next visit to have this conversation, or it is a guide that you can print off and actually give to your patients that will guide them through the same process. But it talks about informing your patients about which plans and insurers you are in network for as a provider, and also gives information to patients about how to go about selecting the right plan. And again, for HIV patients, things like in-office visits and lab work visits are very important parts of a plan to take a look at the costs and limitations and benefits associated with. There's also information in this guide about looking at the formulary for the plan and making sure their medications specifically are covered and any kind of requirements for prior approval that might be associated with the plan's formulary. So it's a very helpful guide that you can download and give directly to your patients. So those are the 3 parts of the AAHIVM Health Reform Resource Center for HIV providers. We hope that you all will go and take a look at it and utilize some of the great tools that are available on it. We also wanted to direct you to a couple of other resources that could be helpful to you as an HIV provider over the coming months. There's a few different websites that we think are particularly useful. The first is HIVhealthreform.org, and this is a website that represents a partnership between several different HIV organizations and their policy departments in terms of putting together a library of information about healthcare reform specific to HIV patients, providers, and interested parties. Kaiser Family Foundation, most of you are probably already familiar with. They're a great resource for exhaustive information about all of the policy aspects of the law. Enroll America is actually a website that you can send your patients to get enrolled in new forms of coverage. It's a website designed specifically for patients and to educate them and help them get enrolled. So www.enrollamerica.org is a place that you can send your patients to. And finally, Families USA is an organization that focuses on a variety of different healthcare topics associated with public health, and they have some great resources about Medicaid expansion in each of the states. So that concludes our webinar presentation for today. If you have any questions, you can contact the AAHIVM Public Policy Department at the number on your screen. And we hope that you found today's presentation useful. Thank you for joining us.